미디어 프로젝트 13주 3차 시간을 시작하겠습니다. 이번 시간에는 기하급수적 변화를 가져오는 기술들과 그 분야들에 대해서 알아보도록 하겠습니다. 주제는 헬스케어입니다.
On the healthcare side, we're going to see a massive demonetization of the cost of healthcare.
올해는 헬스케어에서 거대한 디마니타이제이션을 볼 것입니다.
So this is out of Stanford. This is Sebastian Thrun's lab, in which what they've built is basically machine learning, deep learning protocols that can diagnose.
스탠포드 연구소에서는 딥러닝을 사용해서 피부암을 찾아내는데 피부과 전문의만큼 잘 해낼 수 있습니다.
Dermatological conditions better than a dermatologist, right? So I want you to imagine this is when I have a venture fund, Bold Capital Partners, that's partnered with Singularity University. This is one of the investments we're looking at right this minute.
현재 벤처 캐피털리스트로부터 투자가 이루어지고 있습니다.
But imagine in the near future that when you get into the shower in the morning to go and take your shower, you do a spin around like this. It captures you, and over the course of time, it's able to determine whether you have any kind of, basal cell carcinomas or melanomas, whatever it might be.
가까운 미래에는 여러분이 아침에 일어나서 샤워를 할 때 한 바퀴 돌고 나면 인공지능이 여러분의 몸을 진단할 수 있을 것입니다.
Of course, AI is going to be your diagnostician. When I went to medical school years ago, I remember the moment in time where I thought I had the human body in my brain. There's no possible way in the world that any physician is going to be able to keep up with the amount of data being generated.
미래에는 AI가 우리의 건강을 진단하게 될 것입니다. 어떤 의사도 엄청난 양의 데이터를 처리하는 것이 불가능합니다.
Hundreds of gigabytes of data per person. It's not even feasible. And so we're going to see, this is of course Watson, and this is just about 6 months ago when Watson was able to diagnose a patient who had a rare form of leukemia that no physician could diagnose.
IBM 왓슨은 어떤 피지션도 찾아내지 못했던 아주 드문 형태의 루키미아를 찾아내는 데 성공했습니다.
And the way that Watson did this is it had ingested 20 million different clinical data sets.
왓슨은 이 진단을 위해서 2천만 개의 다른 데이터 셋들을 분석했습니다.
And it was able to understand her diagnosis in context of 20 million others.
여기서 미래의 인공지능이 우리의 건강에 어떻게 도움을 줄 수 있을지 관련 동영상을 보도록 하겠습니다.
But perhaps its greatest impact will be on medicine and the way we monitor human health. Dr. Eric Topol is one of the most influential doctors in digital medicine. The pioneering American cardiologist has helped develop drugs that have saved countless lives. He's now at the forefront of the AI revolution in healthcare. These are his prescriptions for transforming the future of human health.
The overarching goal is to bring back the humanity. If we do this right, we can rescue the problems of healthcare.
The doctor-patient relationship is a founding principle of healthcare and medicine.
The first step is to eliminate keyboards and computer screens in clinical encounters.
Some doctors in the West can spend up to twice as many hours on medical paperwork than with their patients.
In the years ahead, we should be able to eliminate the data clerk functions of clinicians. These are mutually hated as much by patients as by doctors and clinicians.
AI tools, such as speech recognition technology, that are now commonplace in homes, could be used in clinical settings for capturing data and notes, allowing doctors to concentrate on people.
We have a problem with accuracy and efficiency.
Trained on a huge resource of medical data, the power of AI learning can read some images more accurately than humans.
Whether it's a pattern like a scan or a slide, or prediction AI can really rev up the accuracy, and that is important for a better diagnosis, better treatments, better outcomes, lower cost.
Powerful machines can interpret scans 150 times faster than radiologists and can work 24 hours a day. AI can even suggest a diagnosis.
Many conditions could be AI diagnosed. And so the time that a doctor comes into play is very specific to important diagnoses.
Data is critical for improving our understanding of disease and illness. The more we understand, the better the chances of preventing, diagnosing and curing. But currently, only about 5% of medical data is used effectively.
We had a problem with generating so much data, terabytes of data for each person, but we didn't have a way to analyze it. We didn't have a way to extract the juice, the distillate of this. Now we do, and that's what artificial intelligence is really about.
Harnessed to wireless devices, AI could oversee every facet of people's health data, from family history to food intake to exercise.
People will have the opportunity to have this real integrated view of themselves to help prevent illness, to help guide them for better management of conditions. Over time, we'll see this virtual coach for promoting health.
Constant AI monitoring could transform the most prolific diseases that demand the most care, such as diabetes. This would empower people to take charge of their own health.
Another way that AI will kick in over time is to get rid of hospital rooms. We can monitor patients in the comfort of their own home because they can have the sensors that would provide the same type of monitoring as if someone was in the intensive care unit.
Caring for people outside of medical settings would not only prevent hospital-acquired disease, it could also save money.
All these things favor this shift of reliance on a patient's bedroom rather than the hospital room. We're talking about a whole lot of people that don't need to be employed in the hospital setting. That is a great way to reduce the burden in the future. In the United States, a hospital costs $5,000 a night, so you could get a lot of data plans that go for years for that cost. If the clinical community stands up for patients and say, all the power, efficiency, productivity, workflow from AI is going to be used to give the gift of time to doctors and nurses and patients, that's where we flip this thing and achieve a rescue mission for healthcare.
다음은 엑스프라이즈에서 있었던 헬스케어의 경진대회 사례입니다.
Awarded at the X Prize just a few weeks ago, the $10 million Qualcomm Tricorder X Prize. This was the winning team, a family of physicians, brothers out of Philadelphia.
우리는 얼마 전에 퀄콤이 제안했던 트라이코더 엑스프라이즈의 1,000만 불 상금 수상자를 결정했습니다.
That came up with a technology called DXER. And the goal here was a consumer usable system that could diagnose 15 different diseases.
소비자가 15개 다른 질병들을 직접 테스트할 수 있는 시스템입니다.
In the field of continuing health sciences, this is the cost of genome sequencing. You see Moore's law in white over there, and you see that rapidly falling 5 times the rate of Moore's law for genome sequencing.
그래프를 보면 지놈 시퀀싱의 가격이 무엇으로보다 5배 정도 더 빨리 떨어지는 것을 알 수 있습니다.
So in 2001, Craig Venter sequenced the human genome for $100 million. Today, the cost is $1,000. And a few months ago, Illumina, the primary company, announced its equipment that will be sequencing the human genome for $100 in 2 hours.
2001년에는 크래그 벤터가 지놈 시퀀싱을 하는데 1억 불이 들었습니다. 오늘날에는 1,000불이 들고 최근 일루미나는 2시간 안에 100분 안에 해내는 기술을 개발했습니다.
So we're seeing from 2001 to 2017 a million-fold decrease. Again, demonetization in genome sequencing.
20년도 안 되는 기간에 지놈 시퀀싱의 가격이 100만 배나 내렸습니다.
And as we all head towards a world where every baby is sequenced when they're born, all of us are sequenced, and all that phenotypic data is combined with the genome, we're going to start to actually predict what you're likely to come down with.
여러분의 건강 데이터가 지놈 데이터와 결합되면 미래의 여러분의 건강을 예측할 수 있을 것입니다.
And stop you from coming down with it in the first place. The reason healthcare is so ridiculously expensive right now is when you walk into the hospital not feeling well and you get diagnosed, it's for something that's been going on for months or years, and perhaps it's too late to fix it.
지금 의료비가 비싼 이유 중 하나는 여러분이 몸이 안 좋아서 병원에 갔었을 때 이미 병이 수개월 내지 수년 동안 진행이 되었고 고치기에 너무 늦었을 수도 있기 때문입니다.
So imagine instead having medicine being predictive, preventative, personalized, based on your genome and based on massive data sets. So we're going to disrupt and demonetize healthcare by orders of magnitude.
미래의 의료 시스템은 predictive, preventive, personalized입니다. 즉 예측하고 미리 병이 걸리기 전에 조치를 취하고 개인화되는 것입니다.
And of course, the final thing is surgery, and the idea that we're going to pay, high-priced human surgeons to go and cut us open is going to be an anathema, right? You're going to see a human coming at you, and you're going to say, "Oh no, I do not want that human touching me," right? Any of you who ever need surgery, you have one question to ask: how many times have you done this surgery last week? That's the number one correlation between the success of a surgeon. If you find a surgeon who's doing 10 surgeries per day, that's your woman, right? That's the person that you want.
지금 외과 의사를 고르는 데 있어서 판단 기준은 최근에 얼마나 많이 수술을 했는가입니다.
And so when you find a robot operating system that's doing thousands of surgeries per day, and that robot is seeing your innards in in infrared, in minute detail, and is able to do a surgery perfectly because it's seen every variation. And the cost of that surgery is the cost of electricity, and the capex of that robot, the cost is going to demonetize to near zero again.
유능한 외과 의사가 하루에 10건 정도 수술을 한다면 로봇은 수천 건 이상을 해낼 수 있습니다. 또한 수많은 의학 자료와 데이터들을 관리하고 환자에게 맞춤형 수술을 할 수 있습니다. 향후 디마니타이제이션이 되면 그 가격은 급격하게 떨어질 것입니다.
So I just wanted to share, I view the world as rapidly demonetizing.
나는 급격히 디마니타이징하는 관점에서 세상을 바라봅니다.
I see almost every area. I haven't talked about food, I haven't talked about a few other areas, and we see demonetizing trends there as well. But if you look at it, one of the interesting analogies, and I'll close with this slide. So this is the slide of when Kodak lost the game, right? So this is
이 그래프는 아날로그 포토의 강자였던 코닥이 디지털 포토가 나오면서 시장에서 완전히 퇴출되는 것을 보여주고 있습니다.
film photography falling off a cliff, and we're going to see this with gas cars falling off a cliff as autonomous electric cars take off. But this is back in 2011, and what's interesting is I projected it forward, and the number last year was 1.2 trillion, right? So we're going to start to see these kinds of changes where we're demonetizing and changing the game around the world.
만일에 기하급수적인 변화의 그래프를 계속 그려보면 엄청난 변화가 있다는 것을 알 수 있습니다. 이러한 변화가 세상을 디마니타이징하는 것입니다.
And so when I think about AI, I am not worried about the Terminator. I'm not worried about the notion that this advanced intelligence is going to, try and destroy us. I think that's a ridiculous assumption.
나는 AI가 터미네이터처럼 우리를 파괴할 것을 걱정하지는 않습니다.
I understand. I am worried about the fact that we're going to have a disruption of jobs from AI and robotics. And it's not the fact we're going to have a disruption of jobs, it's the speed at which we're going to have that change, right?
물론 잡이 없어지는 것에 대해서는 걱정하고 있는데 더 정확히 이야기하면 잡이 없어지는 것보다 없어지는 속도에 염려를 하고 있습니다.
Or 1810, the exact number is 83% of Americans were farmers, right? And today it's less than 2%.
200년 전에는 우리나라에서 80% 이상이 농부였는데 지금은 2%도 안 됩니다.
So it's the speed at which we have that. So I'm thinking about that a lot. I don't have an answer for that. I'm concerned that people are going to lose their jobs.
AI와 로보틱스 때문에 많은 사람들이 잡을 잃을 것이고 나는 그것에 대해서 해결책을 갖고 있지 않습니다.
And while we're going to have, I think universal basic income is going to come in very strong. I think we're going to demonetize the cost of living so that the cost of living, not living forever, not going to Mars, not doing the extraordinary things, living, being healthy, having a great education, having access to amazing entertainment, all the things that would be what a billionaire can do today, 30 years from now will be basic living.
AI와 로보틱스의 발달로 우리의 삶에 필요한 건강, 의료, 교육, 엔터테인먼트 등의 비용이 디마니타이즈 되어서 우리의 삶의 수준이 크게 향상될 것입니다.
I think that we're going to demonetize those things, but people are going to have, there's going to be psychological impacts to losing my persona of when I ask you, what do? You tell me your career, you tell me your job. So how do we connect people? And so I've been working with Tony Robbins, who's a dear friend, and talking about this. We have to change the story about who you are, what you stand for, what you do. But these are the challenges we have to face. These are the kinds of conversations we talk about internal at Singularity University a lot.
미래에는 당신은 어떤 일을 하세요? 라는 질문을 받았을 때 자신의 페르소나에 대해서 심리적 영향이 있을 것입니다.
Material things demonetized. So there's a company, for example, in Silicon Valley that I've advised called D Foundry that basically has a machine that in one end comes methane, water, and electricity. At the other end comes perfect diamonds, right? So we're demonetizing diamonds, right? You're talking about the eventual potential for $5 a carat.
물질도 디마니타이즈가 가능합니다. 다이아몬드처럼 비싼 보석을 1캐롯에 $5밖에 안 되도록 디마니타이즈 하려는 시도도 있습니다.
We're going to demonetize platinum. Right? One of my company's Planetary Resources, if we're able to go and lasso those asteroids and bring down the price of platinum like we brought down the price of, aluminum used to be worth more than gold and silver until we came up with the ability of electrolysis. So,
알루미늄도 우리가 제조할 수 있기 전까지는 금이나 은보다 비싼 적이 있었습니다.
It's an interesting question. I don't know what we're going to either demonetize or change. So, for example, the cost of a car is still the cost of a car. But when I can timeshare it, it becomes demonetized. Airbnb is demonetizing real estate to some degree, or my use of the real estate.
집과 차의 경우에는 그 자체의 가격이 낮아질 수 있겠지만 타임쉐어링을 통해서 디마니타이징 되는 측면이 있습니다.
So there's different stages and different levels of demonetization. But that's a great question, and one I don't have easy answers for. So, great question, and I'm asked this as a father. I have two 6-year-old boys, and everybody says, like, what do you want to teach them? What do you want to do? And so we're entering into a world where we are all going to have AI software shells. I call it a software shell. It's an AI that is with you all the time, that surrounds you, that sees what you see, that hears what you hear, that reads what you read, that is monitoring your body, that you give permission to all of these things. It's Jarvis for Iron Man.
미래의 AI는 아이언맨처럼 AI 쉘이 되어서 우리가 보고 듣고 읽을 때 함께합니다.
And we're going to have a version of Jarvis within 10 years. And so ultimately, it's not about memorizing facts anymore. It's not about memorizing things. And what I think one of the most important things that we're going to have is the ability to ask great questions. So what I focus with my children a lot, and I focus with entrepreneurs a lot, is asking great questions, right? It's a critically important skill. The other is going to be curiosity and creativity.
미래의 중요한 스킬은 팩트를 기억하는 것이 아닙니다. 첫 번째는 great question을 하는 것이고 두 번째는 curiosity와 creativity를 갖는 것입니다.
I think a lot of what we're going to be doing is creating interesting virtual worlds that we're all going to be exploring in the future. But it's going to become, one of the other things I think about is as AI becomes a dominant force, what is truly human is going to start to become teased out, right? When you look at the difference. And will there be a difference? I don't know.
어펜딕스입니다. 지금까지 시청하신 것으로 이번 차수의 수업이 인정됩니다. IBM 왓슨이 건강 분야에 어떤 도움을 줄 수 있는지 관련 동영상을 보도록 하겠습니다.
The world's approach to health is broken, but that's about to change. Medical data doubles every 3 years, and the $7 trillion health industry is unable to keep up with the staggering rate at which information is produced. From medical records, clinical trials, and research to personal fitness bands, implanted devices, and other sensors that collect real-time data, each of us can generate the equivalent of 300 million books of health-related data in our lifetime. In fact, approximately 35 cents of every dollar spent on medical care is wasted. And yet, there is a reason for hospitals, doctors, insurers, and patients alike to be optimistic about the future. The reason is Watson Health Cloud. The IBM Watson Health Cloud brings together vast amounts of medical data into one centralized thinking hub on the cloud, combining traditional analytics with the advanced cognitive capabilities of Watson. The ability to learn and over time refine its analysis based on what it is learning, to turn this wealth of data into knowledge. Take Raul. Raul has a family, a busy job, and an active lifestyle. He also has a heart condition. It's mild, but it could worsen over time. He works closely with his doctor to monitor the problem, but they have difficulty finding medication that doesn't limit his busy lifestyle. And with the mountain of medical data available, it's nearly impossible to keep up with the latest treatments. Raul's doctor starts using a new app created from the Watson Health Cloud. It allows him to review Raul's personal and family medical history from other doctors, even insurance providers, and incorporate that information with data from Raul's Fitbit. This provides both Raul and his doctor with meaningful insights about his condition over time. Watson Health Cloud operates in an ecosystem environment. As in nature, an ecosystem brings together many contributors to keep the system functioning smoothly. Watson Health Cloud's ecosystem functions much the same way. It combines massive amounts of data and knowledge and brings together researchers, doctors, patients, pharmaceutical companies, and insurers in a secure and open platform. As Raul and his doctor continue to use Watson Health Cloud through the app contributes that data back into the Watson ecosystem. This give and take makes Watson Health Cloud more dynamic, intelligent, and efficient for everyone. The app combines knowledge about Raul's heart condition with data in the Watson Health Cloud from patients with the same condition. Using analytics and insights, the app makes the best recommendations for Raul's care. When a new study suggests a correlation between an allergy medication Raul takes and increased risk of heart disease, the app alerts Raul's doctor and suggests a possible replacement medication. Since the app knows Raul is an avid runner, the app suggests a medication that doesn't interfere with strenuous physical activity. Raul never has to worry about his medical privacy because IBM goes to great lengths to keep knowledge about patients private and anonymous, ensuring that before any of Raul's medical records reach the cloud, they are stripped of any and all personal identifiers. This process refers to de-identification services, which are crucial to creating a safe, secure cloud environment. As the knowledge base continues to grow, apps built using the Watson Health Cloud enable researchers, doctors, and pharmaceutical companies to drive medical advancements and improve patient outcomes. Physicians can be more confident and accountable in their treatments, and individuals like Raul can be more responsible for their own health and wellness by taking preventative action. IBM Watson Health Cloud is rapidly transforming healthcare around the world. Its advanced cognitive capabilities, interactive ecosystem, and secure de-identification dramatically change the dynamic between patients, doctors, and the medical community, creating a brighter, healthier future for all.